Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and today is March the 10th, 2022, and we're now about 2 years into this pandemic, and I think we've got some good news. When we look at all levels, at the world level, at the U.S. level, at the state level, at the local level, the number of cases and the number of hospitalizations from COVID are decreasing, and that is really, really good news. We've gotten some good questions this week, which we'll try to answer. And then we also will go through the litany of how the world is doing with COVID from the top to the bottom. So starting at the world level, the number of cases are up a little bit in the last week. And that's because we're starting to see an increase in cases in places that previously did not have much disease. So Vietnam, South Korea, Australia, New Zealand, which previously did not have much disease, are seeing an increase in disease mostly due to Omicron. But because these places have been pretty well prepared and highly vaccinated, it's spreading, but not spreading super fast. And because most of the people are vaccinated, especially seniors, they're not seeing a lot of hospitalizations and deaths. Places that we worry about a lot, like Africa, has had very little disease. South America seems to be improving. But Europe continues to have lots of disease, and especially the disease in Europe is in Eastern Europe, where there's a lot of disruption now due to the situation in Ukraine. And we're worried that things could spread in that war zone. You can imagine during the time you're escaping from a war zone, worrying about COVID etiquette is not high on your list. And so we're worried that there could be a big spread in that area. Places like Denmark and England that have had a lot of disease for the last few months continue to have a fair amount of disease. They went up, but they have not come down as quickly as we have in the US. In the US, we're down now to less than 15 cases per 100,000 per day. Pretty much in the US, it's very quiet in places that had this early. So New York, Washington, D.C., which had a lot of disease a month ago, now has very little disease. The only hot places in the US now are in Kentucky, Idaho, and Maine. And I think that's because they were relatively last to get this. And I think they're going to continue to come down. But the rest of the country looks like it's coming down nicely. So the number of cases we have now is the lowest amount we've had since the middle of July of 2021. So you remember starting in July, we had the big Delta surge. We had our worst in July, August, and early September, then went down, but didn't go down all the way. And then we had Omicron, and now it's come down, but it's now down to where it was in the pre-Delta days. And that's a good place to be, especially as we're getting to the nicer weather. In Oregon, the number of cases is down, the number of hospitalizations are down, and the hospitals, which just a few weeks ago had over 1,000 people in the hospital, now down to less than 300 there with COVID. Locally, our number of cases is also down. We're down to about 15 cases per 100,000 per day, which is a relatively low amount. Again, the lowest amount since July. We only have a dozen or so people in the hospital. And now of the people in the hospital, many of the people are there who test positive for COVID, but really are not sick with COVID. And so that's a good sign. This is clearly not stressing the hospital situation at this point. So at this point, we have, as we say, there are 6 major things we look at to say if this thing is under control. First is the number of cases low, and indeed is very low. The second is the number of hospitalizations low, and the number of hospitalizations is low and not going to impact the system. The third thing we look at is the availability of an effective vaccine. And although the vaccine is a little less effective against Omicron than it was against Delta and the ancestral strain, it's still very effective against hospitalization and death. And we have plenty of vaccine. The next is, do we have a way to test for it if in case there are cases there? And I think now, maybe for the first time during the entire pandemic, we have plenty of tests. The next is, do you have any therapeutics? So if somebody does get sick, is there something we can treat them with to decrease their risk of hospitalization or death? And we now also have ample supplies of Paxlovid and Molnupiravir, which are these oral medications, or Sotrovimab, which is this injectable medication, all of which can tremendously decrease the risk from the disease. And then last, is there any worrisome variants on the horizon? And really from about the fall of 2020 until January of 2022, there was one variant after another that were coming out. Right now, however, I'm not seeing any new worrisome variants coming. Doesn't mean they couldn't happen, but I'm saying right now we're not seeing those nasty variants, and that's a good sign, because not having variants out there would suggest that we're going to be good for a while. Now, they could come at any time because variants can come from many different places. They can come from people who have it, especially immunosuppressed people, have mutations and then get back out, or it can go from people to animals and then from animals back to people. And I think that's probably what happened with Omicron. The thought is that this spread from a person in 2020, late 2020, to an animal in Africa, mice or rats, we're not sure which, and then came back out to people in the fall of 2021. So this could certainly happen again, but for right now, there are none on the horizon, and I would predict that for the next few months, we're likely to be doing pretty well. So what's happening? We're getting rid of mask mandates. I think that's a good thing. We're going to continue to use masks in hospitals. Probably a good thing to be extra careful in hospitals and healthcare settings. But I think the rest of the mask mandates are going to go away. The other thing that we're going to see, I think, is a relaxation of some of the other gathering recommendations that we've had. Again, with this low level of disease, I think many people can return to fairly normal activities. However, there are some people who are still really worried. They're immunosuppressed, they've had a kidney transplant, and we know that the vaccines and the other things do not work as well in those people. So there may still be some people a little bit nervous about what's going on, and they may continue to wear masks. If they do so, we really need to be kind. We don't know what their underlying health conditions or the reason they're wearing a mask. So if you see people wearing a mask, please be kind. So one of the questions we got this week is, how do the antiviral medicines work? And so there are two different kinds. There's the sotrovimab, which is an injectable antibody preparation. And the way that works is these antibodies, which were raised in a person who had the COVID disease and then multiplied in the laboratory, if you get that, it attacks the viruses in your bloodstream and in the rest of your body and basically neutralizes those, so tremendously reduces your viral load. And by reducing your viral load, reduces your likelihood of getting the disease. We use monoclonal antibodies or antibodies for many other diseases. So if you get a tetanus-likely wound and you're not immune, you can get tetanus immune globulin. For people who get botulism, the treatment is botulism immune globulin, called BIG or BIG. And so we have a lot of experience with that, and these monoclonal antibodies work pretty well. The other way are oral antiviral drugs that interfere with the viral replication. So for example, if you have the flu, you might take Tamiflu, which again interferes with the ability of the flu vaccine to replicate. If you have herpes, you may take acyclovir, which will stop the virus from replicating. So this is, again, these are drugs similar to what we've used in the past for other diseases that seem to work pretty well. The Paxlovid and the sotrovimab, which is the monoclonal antibody, both reduce risk of hospitalization, death by about 90%. So that's pretty good. There's not a lot of other medicines we have that are that effective. So again, if we're asking people that to get vaccinated to prevent the disease, but either if you're vaccinated and get the disease or unvaccinated and get the disease, you should talk with your provider about getting one of these medications, because it could really decrease your risk of hospitalization and death. Now, during the Delta time, we had this Regeneron antibody that worked. It does not work against Omicron, but when we looked at it against that, the rate of death was about a quarter in the people who got the Regeneron versus those who didn't. So it really did seem to work. And what we're really working on now is for people who have symptoms, get tested. If they get tested, talk to your provider about getting one of these medications. These medications are widely available in Douglas County. So really, we would like people to take those so we can prevent hospitalizations and deaths. Another question that came out there is, what about new variants? So and how would we know about these? And the way we know about these is several. One is that when people have the disease, we sample a certain number for variants. So we do the entire look of the genome of the infections and look to see if any new variants are coming up. Now, there are frequently small little mutations that come up, and we expect this to happen, but we're not seeing any particular variants that come up. And this is done in most of the countries of the world, certainly much of the US, much of Europe, and much of Asia really do lots of these. So hundreds of thousands of these a week are looked at, and they're looking for new variants come up, and they don't find it. The other way we're doing is we're looking in wastewater, so that when you have a viral infection, it comes out your poo and then goes into the wastewater stream, and you can check the wastewater stream looking for how much COVID is there and looking to see if there are any variants there. And so that's a very effective way of looking in large populations quickly to see if new variants are coming up. And as I say, the good news is we're not seeing a lot of variants. However, there is disease in animal populations. We talked about mice and rats before, but it's also in mink, ferrets, possums, big cats, white-tailed deer. So it's in many different animal populations and clearly could mutate in those populations and then come back out to the US. So that was it for the questions this week. I think overall things are going very well. We're getting rid of masks tomorrow evening, and I hope that we can stay there. But let me tell you, if things change, and things could change, that we may need to change our recommendations. So if we do see a nasty variant, we might need to go back to masks and all kind of things. But for right now, things look pretty good. And I'm asking everybody to enjoy a safe and happy summer. Thank you.